Welcome to the Neurology Residency Program at Weill Cornell Medicine, NewYork-Presbyterian Hospital, and Memorial Sloan Kettering Cancer Center. We are a premier neurology training program in the heart of New York City. The Neurology Residency Program at Weill Cornell prides itself on developing highly qualified clinical neurologists. The benefits of our comprehensive educational program are enhanced by our ability to offer an abundant and diverse patient population. Within the program, we also strive to cultivate the individual interests of our diverse residents, who may have special aptitudes for careers in research, teaching, leadership, and public service. We emphasize a clinical approach to neurological problems based on an understanding of the pathology, physiology, and anatomy of neurological dysfunction and disease. Trainees learn to diagnose accurately, treat effectively, and understand the impact of social and psychological factors on neurologic symptoms. In this video, we would love for you to get to know the program, including meeting some of our faculty and residents. We will overview the department with an appreciation for our history. We will then speak about our educational environment, a true strength of our training program. Our faculty and residents will then discuss our clinical environment, which includes two world-renowned hospitals, NewYork-Presbyterian Hospital and Memorial Sloan Kettering Cancer Center. We will then take a look at research opportunities and programs that are available to our residents here during their training. Our residents will then be sharing some of their own experiences about our program, and we'll hear about a major emphasis on our culture, wellness, diversity, equity, and inclusion. Our residents will describe our unique strength of having an integrated internship in our residency, as well as the benefits of living and training in New York City.
My name is Matthew Fink. I'm the chair of the Department of Neurology at Weill Cornell Medicine, and I am delighted to welcome all of you to our wonderful medical center and to our residency program. I'd like to tell you a little bit about what we have here because it's not obvious when you look at videos or you even visit the neighborhood. You're actually sitting right in the middle of one of the largest biomedical research complexes in the entire world. First, you have our medical school, Weill Cornell Medical College, which is physically attached to NewYork-Presbyterian Hospital. If you go across the street to the west, you encounter Memorial Sloan Kettering Cancer Center, which is ranked as one of the top cancer hospitals in the United States. You are here as a resident, you have an opportunity to do work at Weill Cornell Medical Center, at Memorial Sloan Kettering, and at Rockefeller University. All of these institutions are wide open to you as a lovely place to live and work.
At Cornell, we truly believe in customizing the resident experience as much as possible to accommodate a really diverse number of interests by our trainees. Many are interested in research, many are interested in being neurologic educators, many are interested in being ambassadors for the field of neurology, using social media and advocacy. We have avenues for them to pursue all of these interests and have a great track record of customizing the residency for all of our trainees to make them really quite successful.
The Department of Neurology at Weill Cornell Medicine has an extraordinary history. Cornell University was founded in 1865. The medical school, however, was founded in 1898. The first professor of nervous diseases at Cornell was Professor Charles Dana. He became the first professor in 1902. He also became the president of the American Neurological Association, the president of the New York Neurological Society, and also became the president of the New York Academy of Medicine. But the true Department of Neurology really started in 1965 when Dr. Fred Plum and Dr. Jerome Posner came here and started a formal Department of Neurology in the medical school, and it has thrived here ever since. We have just an extraordinary history and a tradition which we will uphold, certainly for the duration of my tenure here.
When I think of Weill Cornell and NewYork-Presbyterian Neurology, I think of education and educational leadership. We have 3 faculty in the department that are assistant or associate deans at Weill Cornell Medicine. We also have multiple chairs of education and other related committees at the American Academy of Neurology. When it comes to local, regional, national and international educational leadership, Weill Cornell and New York-Presbyterian Neurology is at the heart.
I have to say that one thing that truly sets this program and this department apart from others is the people. I think this residency has truly been able to cultivate a feeling of transparency, integrity, and a family.
Every department really has to have an education mission in addition to its clinical and research mission to be well-rounded, and we really focus on our education mission just as much as our other two. And I think that's something that's really important, and it will come across every single day as you come into this residency program and see how we operate. So a really novel feature of our residency program, and something I think that really distinguishes us, is our focus on academic educator development. We have a specific track for residents who are interested in career development as clinician educators.
This sort of environment lends itself to resident research projects and case reports, and the faculty is very dedicated to the education of the residents with its own set of educational conferences at MSK.
I've been here since 1988, and the reason for that is because, in a nutshell, this is a really nice place to work. The residents and the house staff are outstanding. They're hardworking, they're smart. They teach me maybe more than I teach them. I learned so much from Morning Report that I decided that I thought we should get CME credit for it, and I applied to the CME office and they agreed. And 4 days a week for 45 minutes, the attendings are here, the residents are here, they bring papers, everybody shares their experience, and it's a wonderful learning environment.
I'm the stroke director at Cornell, and I am very proud to work with our residents who really are the spirit and the backbone of our stroke program. We now have achieved the highest designation from the American Heart Association for stroke centers. We have one of the fastest door-to-needle times in the country. We are involved with many cutting-edge research studies.
Our residents have an unparalleled exposure to cancer medicine as well as to neurologic disease while rotating here. Additionally, our residents are often involved in numerous research projects from bench to bedside. One of the most fulfilling parts of my job is being part of the training of our future leaders in neurology.
MSKCC is an amazing place to train and practice as a budding neurologist. Within the first month of PGY2 a year, residents get amazing exposure to clinical localization here. As a resident here, you learn through examples and mentorship from faculty and other fellows how to deliver difficult news and outstanding care to our patients in a compassionate way that will really serve you no matter what field of neurology you decide to practice in.
We have, aside from the inpatient service, of course, also an outpatient experience for our residents. And that is a combination of rotations throughout all the different outpatient clinics of our general practitioners as well as specialty practitioners. It is a very dynamic environment, and there are so many opportunities in terms of clinical work, research, and education in this tri-institutional area between Rockefeller, Sloan Kettering, and Cornell.
The place is an academic phenomenon, which is great, but it is also incredibly clinical. We really work on taking care of patients. There is a community spirit, there is a sense of responsibility to the patients that starts at the front door and goes to the dean of the college. It is really quite impressive. People here are nice, people are friendly, and that makes a difference to how you work your day-to-day life.
One of the greatest training opportunities for residents is to engage in research. As neurology as a specialty is very sensitive to the size of the surrounding human population, training in New York City is a huge advantage to the Weill Cornell Neurology Program. Training at Weill Cornell itself provides a unique opportunity to dig deep into the meaning of new observations that can be made and to see if they can yield new scientific insights.
Really the main interaction point these days for me with the residents is in trying to help them get involved in research, pursue their research questions, and trying to launch them on academically oriented careers if that's of interest to them, which for a lot of our residents it is. And so as a result, our residents I think have a great track record of being able to publish first author manuscripts, which obviously helps them contribute to the field, but to me, most importantly, has gotten a lot of our residents excited in research for the first time.
There is a strong interest to recruit from the residents in neurology to develop, scholarship and eventually to have academicians, come out of this program. Has always been the case over the past, 30, 40 years. And we really have a great history of tapping into the residency program to really opening up the laboratories to allow the residents, to work and to develop in, as I said, that scholarship.
The highlights of this program is really the environment of all of the faculty, every single person who works on the faculty having an open door policy and being open for questions and also to help you develop your individual interests. There was such enthusiasm and support that I developed an interest in clinical research in the field of CIDP. So through my experience, I think it's really important to be open-minded and to foster interests as they develop during the course of your residency.
The neurology training program at Weill Cornell is the best in the nation. Both our outpatient and inpatient services at NewYork-Presbyterian Hospital and Memorial Sloan Kettering are filled with patients of diverse backgrounds, a ton of fascinating neurology.
I think that the program's greatest strengths are that the graduated autonomy that they offer all residents, and I think it has helped me become a very independent clinician.
Throughout my years here, though, I truly learned that the best thing about this program is the people, from my truly fantastic co-residents, attendings, fellows, NPs, and PAs. We are one big happy family.
One of the things that drew me to Cornell Neurology is the fact that it's a combined program. So we do our intern year and our neurology years all in the same place, which leads to a very smooth transition and really enables you to start building mentorship relationships early on, and so you can really start delving into what areas of neurology you find most interesting.
The program also supported my interest in advocacy. A group of us, including our program director, Dr. Robbins, as well as one of the stroke attendings, Dr. Parikh, went to Neurology on the Hill with me this past year, and it was a really transformative experience, and I hope to do more advocacy work with the program in the future.
What I notice when I see the residents interacting with each other, I see a real great connection. They share energy with one another. It gives me great pride to watch them grow and glow in their personal and professional lives.
Our goal is to make everyone feel valued and respected and included in the life of this institution. And we feel uniquely positioned to understand, interface, and to relate to their needs as they reflect our success.
I came into neurology residency unsure of my neurologic subspecialty, and I was truly amazed by the neurology I saw at MSK, which led me to want to stay on for fellowship and as faculty.
You have a lot of support all around you, so even though it's one of your first inpatient services, or it was one of my first inpatient services as an intern, I had a lot of support around me and kind of picking up things as you go as an intern, but you're really the sole provider for some of these patients as their neurologist too. So even, fresh as an intern, you're starting on an inpatient neurology service, and you really get that great neurology experience that, I'm sure a lot of you are looking for.
Right from day one, you're also included in the neurology program, from events with the other residents to neurology exposure via rotations, and also access to mentors and the ability to start early with research in neurology.
On the interview trail, I definitely explored a lot of places around the country. But after coming to New York City, I quickly realized that there was no other city in the entire country like that. It really makes residency an amazing place to train.
Make sure to check us out on Instagram at Cornell_neurology or on Twitter at WCNC Neurology.
Please come check us out virtually, and we'll make you a part of this family too.